Hello everyone, this is question 29 of our 100 clinically oriented anatomy questions. Let's get straight into the video. Question says a 61-year-old female immigrant had been diagnosed with spinal tuberculosis. The woman had developed a fluctuant red tendal bulge on one flank with a similar bulge on the groin on the same side. This presentation is likely due to the spread of disease process within the fascia of a muscle with which of the following actions are the hip: abduction, adduction, extension, flexion, internal rotation. So the major thing that the question told us is, okay, the woman had spinal tuberculosis, which is a bacterial infection of the spine that is caused by the Mycobacterium tuberculosis, the same bacteria that causes pulmonary tuberculosis. So the spinal tuberculosis actually affects the spine, affects the disc and the vertebral column, basically. So it causes degeneration of those bones, and so they said the woman had a fluctuant red tendal bug on one flank. So the flank of your body is the lumbar region, basically. That is the region between the ribs and the hip. So that is basically the flank of the body. And they said the woman had a red tendal bug on that side. So the muscle that is primarily around that side, that extends from that side to the hip, is basically the psoas major. All right. So the origin of the psoas major is the lateral body of the L1 to the L5 vertebrae. All right. So that is the origin of the psoas major, and it's around the flank of the body. It's inserted alongside the iliacus muscle on the lesser trochanter of the femur. So that is the most likely muscle that is affected in this case. So the iliopsoas muscle is the major flexor of the hip. They are major flexors of the hip. That is the iliacus muscle and the psoas major. So they are major flexor of the hip. So the spread of that disease along the fascia of the iliopsoas muscle is going to affect flexion at the hip, and that is option D. So here's the correct answer, option D. Now, abduction. The major muscles that are responsible for abduction are the upper fibers of the gluteus medius and the gluteus minimus, and they are supported by the all those small muscles, the quadratus femoris, the obturator internus, superior gemellus, inferior gemellus, obturator internus, and the likes. The adduction is majorly by the adductor muscles, that is the medial compartment of the thigh, the adductor longus, adductor magnus, and the adductor brevis. Um, extension of the hip is majorly by the gluteus maximus. Internal rotation is majorly by the adductor muscles, and also the gluteus medius and the gluteus minimus also help in internal rotation of the hip. So the correct answer is the flexion of the hip joints, which is as a result of spread of disease within the fascia of the iliopsoas muscle. So I hope that is explanatory and you understand. I'll see you in the next episode. Thank you.